Hello everyone, welcome back to this walkthrough of the MLA content map. Today we're going to talk about surgery. The first thing is acute pancreatitis, very important. Know the signs, the symptoms, epigastric pain, radiating to the back, alcohol history, gallstones. Sometimes they like to give you images in this case. Sometimes they like to give you CT scans. Sometimes they like to tell you the findings of imaging or investigations in words like calcification or necrosis of peripancreatic fat. Whatever the case may be, really do this well. Know what you're going to do in this case. Know how you're going to manage this patient. Whether you get MCQs or an OSCE station, this is really important. It does show up in your exams. Next, you have anal fissure. Anal fissure is something that you should know well for your, of course, your MCQs, but your OSCE stations as well. In particular, you should know that you're not going to proceed with a digital rectal exam in the case of an anal fissure, and just know what you're going to advise the patient. Of course, give them laxatives, um, and let the lesion heal. Next, you have aortic aneurysm. We've discussed this before, but know how to examine an aortic aneurysm, how to pick it up on an abdominal exam. You could get a ruptured aortic aneurysm in the case of an emergency scenario. Do this well. This is, I would say, more of a new topic, more of a new station, more of a new MCQ. So do this well. Pulsating mass in your abdomen is usually how this shows up. Next, we have aortic dissection. Also, a very important scenario. Know how this presents. They love to ask you multiple choice questions on this, but also you may get this in the case of an emergency scenario in your OSCE stations. Next, we have aortic valve disease, um, aortic regurgitation, aortic stenosis. I don't think they'll ask you about the heart sounds or the sounds you'll find on palpation necessarily, but still know what you'll find in these cases, and know what conditions cause aortic valve disease. Okay. Next, you have appendicitis. Very important. Know the criteria of appendicitis. Okay. Know how you're going to score it. Know how you're going to diagnose it. Um, know what you're going to find on abdominal exam. Know all the signs you're going to find on abdominal exam, the pointing sign, the Rothschild sign, the rebound tenderness, all those things. So do this well, very important for your exams. Next, you have breast abscess and mastitis. Of course, whenever you get an abscess, you know you need to do incision and drainage, give the patient antibiotics, all that stuff, but know how to examine the breast, okay? And look at pictures of this, okay? Look at pictures. This is important, okay? They could give you a picture in these cases. Next, you have breast cancer. Again, the examination of the breast is very important, okay? Do it well, okay? Really do it well, because you could get a teaching station, you could get a station of breast cancer, you could get a breast abscess station in your OSCE stations, and of course in your multiple choice questions, they could ask you about breast cancer and its markers. So do this well. It's an important topic. It does show up. Breast cysts. Know the different types of breast cysts. This usually shows up in your multiple choice question exams. I haven't seen it show up as much in your OSCE stations with as much variety as it does in your multiple choice question exams. Next, you have colorectal tumors. Again, sigmoidoscopy, colonoscopy. Know what investigations you're going to do. Know how this is going to present. Patient may present with bleeding from in their stools, and of course the flaws. Remember to ask flaws. I know the age group in these cases, the genetic abnormalities in these cases. Okay, another thing they love to test you on. Next, you have fibroadenoma. Okay, this is something that I have seen show up in your OSCE stations where they give you a combined station. So they'll ask you to examine the breast in addition to the patient's history and management and everything else. So do this well. Fibroids. Okay, so fibroids are important. You need to know fibroids. You need to know the presentation of fibroids. You need to know the treatment, but you also need to know how fibroids are going to impact your choices for contraception, and if they are going to impact it. So if a fibroid is deforming the uterus, right? In those cases, you can't give the patient a uterine implant, right? So do fibroids well. Again, something that does show up. Look at pictures of fibroids as well. Gastrointestinal perforation, an emergency scenario that they do like to test you on, okay? And in your auscultations, usually what you're going to do is you're going to go for abdominal exam, and then the patient is going to start screaming in pain. You're just going to stop it right there and then, and you're not going to proceed in these particular cases with the abdominal exam. You're just going to stop right away as soon as you touch the patient's tummy. They're going to scream, and you're just going to stop, okay? After apologizing to the patient. But look at X-rays. Look at X-rays of gastric perforation and know the findings you're going to see in these cases. Next, we have hernias, direct hernias, indirect hernias, ring occlusion tests. Do those well. You could get a testicular exam with an indirect hernia. You could get a hernia anywhere else in the body. So abdominal exam, testicular exam, very important. Know the differences between direct and indirect hernia. Know the tests you're going to do. Again, important. Next, you have intestinal ischemia. This is something that does show up in your multiple choice question exams. I haven't seen it show up in your OSCE stations yet. I really haven't seen a station of this. Maybe it has shown up, but I know the presentation of intestinal ischemia. I know how the patient is going to present and what you're going to do for the patient, intestinal obstruction, and ileus. So these cases usually show up as post-op cases, right? So the patient has had surgery and now their bowels are, paralyzed and they aren't passing stool, they aren't passing gas. So in those cases, what are you going to do? How are you going to proceed? These cases as well, where there's intestinal obstruction and it's an emergency scenario. In these cases as well, you might go for abdominal exam and the patient might not let you examine their abdomen. So yeah, again, an important scenario. Next, we have intussusception. This usually shows up in the case of children. Usually. It could show up in the case of an adult, right? But it does show up more so in the case of children. So target lesions on ultrasound, that is something you should know. Telescoping of the intestines, know the signs, and of course the jelly-like stools, know about that as well. Esophageal cancer, okay, esophageal cancer. Know how this differs from other esophageal conditions. So it's progressive in that you start with difficulty swallowing liquids, and then eventually it progresses to difficulty swallowing solids. Again, you got your flaws, you got your causes of esophageal cancer, right? You're smoking and Barrett's esophagus, eventually leading to adenocarcinoma, those kinds of things. So do this well. This does show up in all your exams. Okay, next you have ovarian cancer, CA125. Know the different types of ovarian cancer. Know how the patient is going to present. And know the investigations you're going to perform in these cases as well. Know what a teratoma is, and that's usually how it shows up. Meg's syndrome may also show up in your exam. I have seen this show up in your OSCE stations where the patient has ascites with an ovarian tumor. Okay, so do it well. Next, we have pancreatic cancer. Pancreatic cancer is something that you should do well. I haven't seen it show up in OSCE stations as much. In your MCQs, definitely it does show up. Next, you have pelvic inflammatory disease. STI, partner notification program, gum clinic, right? Do this well. Pelvic inflammatory disease does show up. It may show up as a patient who has infertility or maybe has pelvic pain. This does show up in your OSCE stations, and in the case of your MCQs, know which organisms cause pelvic inflammatory disease as well. Next, you have perianal abscesses and fistulae. So perianal abscesses and fistulae may show up in your MCQ questions. I have seen multiple choice questions show up about these. Know the different types of fistulae, right? High writing fistulae, lower fistulae, more superficial fistulae. Perianal abscesses. Know how this presents. Know what they're going to describe this in words. Okay. Next, we have peritonitis. Peritonitis, know the abdominal findings, abdominal exam findings, okay, in these cases. Next, we have postpartum hemorrhage. This is a case that does show up as an emergency scenario in your SIMMEN cases in your exams. right? Where the patient has had postpartum hemorrhage and their clothes are stained with blood, and the nurse calls you in and said the patient had a delivery, and now they're hypotensive and they're hemodynamically unstable. They may have an atonic uterus, and you have to massage the uterus. So really do this well. This does show up in the case of emergency hospice stations. Next, you have surgical site infection. Know the different antibiotics you could get to the patient. Know how this is going to present. And this may show up as an angry patient. Okay, so the patient may actually be angry about the infection that they've had at the surgical site. They think it's your fault. So know how to explain to the patient that this is something that could occur. It's one of the complications of surgery. Next, you have testicular cancer. No testicular examination. Do the examination really, really well. All right, know how you're going to decipher testicular cancer on examination. Know what you're going to do for the patient. Okay. Next, we have testicular torsion. Again, another emergency scenario. They'd love to ask you this question in your multiple choice question exams. I haven't seen it show up in hospice stations, but it could show up. So know how this presents, know what you're going to do. Varicose veins, do the examination really well. Okay, so varicose veins on its own, look at the pictures. Okay, look at the presentations, but examination of varicose veins is important. Okay, they may actually ask you to examine varicose veins in the exam, and you should be able to do it. Okay, next you have volvulus. This could show up in the case of children, right? Uh, Volvulus, extreme pain, right? And know what you're going to do in these cases as well. This is something that I have seen show up in your multiple choice questions more so than your hospice stations, but it could show up in your hospice station. So you should know this. And next, of course, we have these presentations in these particular conditions. Just take a look at them. In particular, rectal prolapse isn't something that I have seen show up in the past, so just look at this. This might be a newer scenario or a newer question. The rest of everything else I have seen show up quite commonly and quite frequently in your exams. So do this well. Hope this helped. See you next time.